Is it me? Is it you? Who knows? Guess autoimmunity. I know, kind of the hack introduction, but kind of fits given the topic we're going to be discussing here today. Chronic and mysterious symptoms may be autoimmunity. Yeah, more often than not, if you can't get to the bottom of what's afflicting you, it's more than likely going to be an autoimmune response or a condition in some form or fashion. And we've talked extensively about how you can get around autoimmunity, okay, the different diseases that are out there without having to resort to pills. It mostly just kind of revolves around getting your diet on point, stop disrupting your gut microbiome with a bunch of different ancillary disgusting things that you put inside your body. You do that type of stuff, and imagine that, a bunch of different autoimmune things, little floaters in your eyes, little eczema patches, okay, just aches and pains and different flare-ups that are in your body. They just seemingly go by the wayside if you get your sleep on point, you get your diet on point, you get your probiotics, your prebiotics inside of you, you get your nutrients on point. It sounds like a lot, but realistically, if you stop eating out of boxes and bags, it's not all that difficult. So let's take a look at some of the symptoms that might be a little bit of a tip-off that you're having an autoimmune response problem. While heart disease and cancer dominate the media, millions more people suffer from the barrage of miserable and sometimes debilitating mystery symptoms. These symptoms can rob them of energy, motivation, ability to function, livelihood, relationships, and even their hope. It takes most patients many years of visiting multiple doctors before they finally find out that an autoimmune disease is causing their symptoms. Until then, they're told they're perfectly healthy, accused of making up symptoms that don't exist, or prescribed antidepressants, which are terrible and barely work. Never mind that they can't get out of bed, they hurt all over, their brain barely functions, they have lost motivation to do anything, they can't lose weight but are losing hair. Well, that's one thing that you're losing. Or they have a myriad of other unexplainable health issues. When these patients find their way to functional medicine, testing shows that many of them suffer from early stages of autoimmune reactivity, a condition in which an imbalanced immune system mistakenly attacks and destroys a person's own body tissues, usually slowly over many years. Yay! Doesn't that sound like fun? But thankfully, it's at least reversible a little bit. It's at least pausable. Pause. Autoimmunity can attack any tissue, enzyme, hormone, or cell in the body depending on a person's genetic predisposition and their unique inflammatory triggers. Common examples of autoimmune disease includes Hashimoto thyroiditis, konnichiwa, multiple sclerosis, there it is, rheumatoid arthritis, psoriasis, vitiligo, celiac disease, Graves' disease, type 1 diabetes, lupus, and some inflammatory bowel diseases. Normally, our autoimmune system defends us against bacteria, viruses, and other pathogens. However, immune imbalances and chronic inflammation can cause it to attack the body's tissues, organs, and glands too. So, this is called autoimmunity or self-attack immunity. Yeah, autoimmunity kind of rolls off the tongue a little bit better. In the early stages of autoimmunity, our immune system makes immune antibodies that erroneously stick to our own tissues instead of attaching to foreign invaders. While these antibodies attach to their own tissue, this signals our immune system to send out destructive immune cells called natural killer cells, to destroy the tissues, and just as it would destroy a pathogen. Millions of people suffer for years or decades without treatment because insurance companies don't approve screening for autoimmunity until the patient shows significant signs of organ or tissue destruction. Great, by the point that it's too late that you might require, at least surgery, if not an entire replacement. Great, wonderful, fantastic. At this point, the patient can be prescribed some type of immune suppressing treatment. Which ends up negatively affecting your overall immune system so that you just become more susceptible to infection and viruses. Great, wonderful, fantastic. Instead of just, basically getting your life together, how about try that instead, first and foremost, before popping pills? But that's just my opinion on it, right? However, a patient's ever-worsening symptoms and declining function can go on for years before diagnosis. Until then, doctors continue to tell patients that they're perfectly healthy. This is unfortunate, as early antibody testing allows patients to make dietary and lifestyle modifications to relieve symptoms and prevent the condition from progressing. That's what I'm saying. See, I'm not a doctor. I just read articles. Let me give you an example. No, please, let me. Let's say a person starts to develop an autoimmune reaction against their joints. It could have been a skin or tissue, skin, thyroid, brain, but in this case, let's make it simple and say the autoimmune reaction is against their joints. In the early stages, they may suffer from chronic joint pain with varying degrees of recurring pain. At first, their joints look normal. There is no joint fusion, deformity, or arthritic nodules yet, just pain and inflammation. The doctor visits and will likely result in nothing more than advice to take an over-the-counter drug for inflammation and pain. Yeah, just take a Tylenol, just relax for a little while, stop using it. It's probably just overused or something like that. Just wait. So you go get some Advil and a bag of chips or something like that, and the cycle continues and may or may not get worse. Over the years, the autoimmune reaction progresses, and they develop joint fusion, deformity, and arthritic nodules. Now, finally, they receive a diagnosis of autoimmune joint disease, such as rheumatoid arthritis. But the damage has already been done. Not saying it's not reversible, but the damage has already been done. If their doctor had simply screened for joint antibodies in the early stages, the condition could have been identified, and its progression either significantly slowed or completely halted through dietary and lifestyle applications. It's unfortunate that millions of patients spend much of their lives suffering because of this disconnect, especially considering how clear the research is. Studies show antibodies appear in the early stages of autoimmunity and can be used as both diagnostic and predictive tools in clinical settings. Yet, both conventional and alternative healthcare providers aren't up to date with the research. Most medical schools still only teach how to identify late-stage autoimmune disease, not how to identify autoimmunity in its early stages, and nor how it affects its progression through dietary, nutritional, pharmaceutical, or lifestyle applications. Survey conducted by the American Autoimmune-Related Disease Association found that the average patient diagnosed with serious late-stage and clinically obvious autoimmune disease had seen more than 4 doctors over a 4-year period before receiving a correct diagnosis. I know a patient who has seen as many as 20 different doctors looking for help. I don't. That's just the author right there. Datis Karzan. He's a PhD. I've got a PhD. Most patients aren't aware of their symptoms due to their early stages of autoimmune disease. They've seen numerous practitioners, both conventional and alternative, because a connoisseur of hundreds of supplements, tried multiple diets of every extreme, taken to the internet to search, vent, and commiserate with many of the people in the same boat. Every supplement and every therapy is a shot in the dark. Occasionally, they stumble into or onto what seems to be a miracle cure, but for the most part, symptoms of undiagnosed autoimmunity turn into a life of endless searching and experimenting. Autoimmune management requires a personalized approach for overhauling your diet so that it's an anti-inflammatory, removing other inflammatory triggers from your life. They're different for everyone. But there's kind of a generalized group that you probably want to get rid of. Gluten, dairy, any other, foreign antibodies that are forcibly put inside your body. Don't need to name anything specifically, but, hey, pay attention to what goes inside your body. If it's not just the old saying, nothing in a bag, nothing in a box, you should be a little bit all right. But stay clear. If you need a nice little roadmap for you, dairy and gluten, just get rid of it. Nothing's good there. It's normally calorically dense and nutritionally deficient. Stay away from them. Getting daily physical activity, but not overtraining. Getting plenty of good quality sleep every night and avoiding toxins, including toxic situations and people. And yes, the doctor gives more advice on his podcast, drknews.com, his books, his videos, podcasts, blah, blah, blah. Or you could just hang out with me. I'll throw in a couple of different jokes and we'll talk about these types of topics because I find it very interesting, especially when it comes to, instead of just, going in there, getting pills pushed on you, there are things that you can take control of in your own life, things that you can do in order to improve your lot in life instead of just resign it and charge it to the game. No. You take responsibility for the actions that you do, the things that you ingest inside your body, and lo and behold, given enough time, with enough consistency, you will become the best version of yourself. That's all I want, and that's all I want for you. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.